Good afternoon. My name is Barbara Sheldon. I'm here to present to you my career goal of being a nurse. Presently, I am an LPN and I've come here back to school to become an RN. As a nurse, there are many directions you can take, many different avenues. Working in a hospital, you can work in an operating room, you can work in an emergency room, you can work on the floor, helping children and pediatrics or helping older people. You can work with cancer patients in oncology. You can work with orthopedic patients. You can work with heart patients, many different directions in a hospital alone. You can also be a travel nurse. That would be going from city to city or country to country, spending 6 months or a year, helping to fill in at a hospital, and then moving on to a new location. You can work in the community. There are many different opportunities in the community as a health nurse, as a school nurse. You can work as a research nurse. You can work in the court system as an expert witness. You can work in travel, research. You can work as a nurse educator also, which is a great field. You can work in a doctor's office, many directions. For myself, I'm looking to work as a missionary nurse. That would be, I would go on short missionary trips to different locations, countries that are underserved, and help them in their nursing needs. I could go for 6 months, I could go for 2 months, and help in different facilities. I'm not quite sure which direction I want to go in as a nurse, but 3 main ones that I'm looking at. The first would be going as a labor and delivery nurse. The reason I am really attracted to this started when my son was in the Peace Corps in Africa. He helped to build a maternity clinic in a far out community that has no facility there. He helped to build that community clinic, and this would help the mothers that would have to travel 4 hours in the back of a pickup truck to get to help when they were having a difficult labor and delivery. So this is really kind of given me a heart to help in labor and delivery. I kind of have a fond spot for that. Another direction that I may go in is as an operating room nurse. I like this because this is where I could work on a ship such as the Mercy ship that travels from port to port to help needy patients that otherwise could not receive the operations that they would need. In an operating room section, I could be a post-op nurse, a pre-op nurse, anesthesiologist, which is actually the highest paying nurse that you can become. I could be a first assistant. I could be the nurse that does the documenting in that setting. That would be, just many different things just in an operating room setting itself. The third direction I'm thinking of going in would be as a wound care nurse. A wound care nurse helps with patients that have wounds that will not heal. These are not your just cuts and operations, but these are wounds that tend to get infected, can get sepsis. These are wounds that stay for weeks and weeks or months and months that need special care. So for this presentation, my plan is to be a missionary nurse in one of these 3 fields. But for today, we're going to specifically talk about a wound care nurse. And I could do this on a ship. I could do this in a clinic. I could do this in a hospital. A wound care nurse is a nurse that would be helping mostly patients that are diabetic or patients that are patients that are obese, patients that have circulatory problems. These patients would be the ones that we would be needing to treat. As a wound care nurse in a hospital, my day would be visiting anywhere from 8 to 20 patients a day, spending an hour or a half an hour with these patients, assessing their wounds, dressing their wounds, changing their devices. There's many different devices involved in wound care, devices to suction out extra fluids, devices to help heal a wound faster. Teaching the families and teaching the patients themselves how to take care of these devices and how to bandage their own wounds, helping them to be ready to go home, get out of a hospital setting. So there's a lot of teaching involved. I like this position because there's a lot of personal time with these patients, time that's one-on-one more so than many of the other nursing positions. You go back to the same patient over and over a multitude of times, and you see the progression of their healing, and that can be very satisfying as well. So a wound care nurse would be helping to assess, helping to treat, helping to educate, and also document. During each day, you would be doing these things with each of your patients in the settings that you would be in. As a wound care nurse, I would need to have my RN degree and then also additional certification. That additional certification I would first have to have at least 2 years of nursing experience. Then I would have to take a 60-hour course, a certification course, and then I would have to have 120 hours of clinical experience with a wound care nurse. I've spoken with a wound care nurse in Jacksonville at a wound care clinic that I could get that clinical experience with so that I would be prepared to treat wounds on my own. The benefits of any position in nursing would be, let me speak of this slide first, please. Any nurse can be an LPN or an RN. They would get that training in a community college. You can go on and be an RN with a 4-year degree, even go on further, get a master's degree or a PhD. And then you can continually get certifications in different specialties. There are many types of specialties. The one I am pointing out is the wound care specialty, but each of those have their own special certification. This range of education comes with higher pay levels and, of course, higher levels of responsibility. When you get into your master's and your PhD, that's the level you'll need to be at to be in a teaching position or to be in an administrative position as well. So, why would you want to be a nurse? Great satisfaction in helping people. I think, it's more blessed to give than to receive. I think there's a lot of benefit in just helping people. There's so many opportunities in nursing. That's another great reason. You can start as a nurse in pediatrics and you get tired of dealing with screaming kids and you can go to geriatrics, or you get tired of being in the operating room and really can't converse with your patient too well, so you can go to wound care. You have a lot of personal time with your patients. So there's lots of different directions you can take, and that's a great advantage in nursing. There's job security. There are a great demand for nursing in this country and around the world. There's a real sense of pride, I believe, in nursing. I have it myself. I believe most nurses do. There's also perks as far as your work week. Most nurses only work in a full-time capacity only 3 days a week. That would be 3 12-hour shifts, and then you're done. You have 4 days free. Pay scales are pretty good in nursing, starting from $60,000 on up to the highest, which would be the anesthesiologist, at about $150,000 a year. But there's also many pitfalls for being a nurse. The biggest one that you see that nurses report, 43% are reporting burnout. They are just worn out, frazzled out, overworked, overstretched, worked too many hours, too much time on their feet. There's a lot of stress and a lot of stressed out nurses, 43% of which have reported burnout. Stress is there because you have a big patient load. Hospitals are there to make money. They will put in your responsibility as many patients as you can handle and then some. It's a lot of work. It's a lot to do in one shift, a lot of people to take care of, and you just get stressed out because of all that responsibility. There's the liability. When you have that many patients, it's easy to make mistakes, easy for you to make a medical error. If you're a computer expert and you make an error with your computer crashes. But when you're nursing and you're making a mistake, it's a person crashing. So there's a lot of liability involved in being a nurse, and that contributes to the burnout. That contributes to the stress. There's a lot of paperwork. Nurses don't like the paperwork. It's evolved more and more so in the past years with more regulations, HIPAA and healthcare regulations, Medicaid regulations. Paperwork has really become a burden for most nurses. They don't feel like they can spend enough time with their patients because they have to spend it doing the paperwork. Another interesting problem for nurses is being assaulted. 24% have stated that they have been assaulted either by the patient themselves or by their families. That's another quite interesting and unexpected problem with being a nurse. So, how am I going to get there? My plan is I'm taking these 2 prerequisite courses this semester. I am taking 2 semesters, of a transition program, LPN to RN program. After that, I will take the wound care certification course. Then I will take the 120 hours of clinical wound care time. After that, I will work probably at least a year in a local hospital or a local clinic doing the wound care to get the experience that I need before I go on any type of overseas trip. I plan, I hope, I pray to work with an organization such as Samaritan's Purse. There's other organizations, of course, there's many different ships. Red Cross has ships. The Mercy ships are well known. CARE is another organization that has ships. There's Doctors Without Borders. I could also work with them. Many different church organizations also have nursing opportunities abroad. Baptists, Catholics, many of them, the larger organizations, have nursing opportunities in mission field settings. So that's my plan. That's my goal. And I hope you've enjoyed my presentation, and thank you so much for watching.